Okay, sir, I'm just going to be connecting these electrodes to you so we can monitor your heart so it won't hurt.
I'm going to go ahead and just listen to your lungs for a minute.
How old is this gentleman?
He's in his early 70s. This unit has the ability, starting with the airway, of different styles of breathing. It also has the ability to have wheezes, crackles, stridors, which are a number of different airway sounds that would be detected in different patients having different type of respiratory complications. It can also hook up to our heart monitor. Through that, we can simulate different heart rhythms. So again, as a crew comes in, they can hook up the heart monitor, start assessing what the heart is doing on the patient. It also then allows for you to take pulse rates of your patient. It's got 12 different pulse point places around the body. So again, feeling down in your wrist, you can get a pulse rate here. You can come up into the neck to the carotid, get a pulse rate up here. And then again, being able to use that again for your assessment. Along with that, it has the ability to do simulated blood pressures. So with the unit hooked up, your EMT can come in and take a blood pressure as they normally would on a patient, placing the stethoscope into the AC space of the arm, pumping up the syringe on the BP cuff, and then as they let the air out, the unit will actually measure, and to what we have set on the computer system will show that blood pressure. We can use any of the airways we use in the field, nasal airways, Orenfield airways, which are just go into the mouth, and are advanced like the combi tube, and at paramedic level actually be able to intubate the mannequin. Gives those options, and with that too, then they can also use the bag valve mask, again, to simulate the rescue breathing and what needs to be done that way. The unit also has what's called an IV arm. That's this right arm here. And through a set of connections, we can run a red dyed fluid, just basically sterile water with a red dye in it, that would come down through the vein. With that, they then can come in with their IV equipment, be able to take the needle, come down, insert it into the vein, and with that they'd see the red flashback as you would on an actual patient, and at that point they can then disconnect, advance the catheter such as they would on an actual patient. Also in this arm, it has a location for practicing giving shots. Our medics are able to give a number of different medications through injection in the field. So that's what they can practice on here. Again, this can take up to multiple injections, and then at that time the unit is replaceable. We just take the piece out and insert a new one. Let's just come up with like a GI bleed.
Well, yeah, I was going to say there's some kind of infection with an internal bleed. What we got there?
And they'll come along, yeah. And again, you know, you'd have your patient, and at some points they're fine. Usually, you know, a lot of times when they're laying down, they're fine. But again, they stand up and then all of a sudden get dizzy, pass out.